everybody. My name is Dr. Patrick Flynn, and welcome to this morning's A Different Perspective. Yes, after doing this for almost a year and a half, we have decided to change the name to A Different Perspective because that is what I am always going to bring to you. But on top of it, we could no longer call the quick tip because most of these things lasted for at least an hour or so. And today is no exception. Today is going to be a multiple part series because we are going to discuss something that's very emotional and very intensive, but we're going to start out with a different perspective on this. So the quick tips will still exist, but I promise you the next time you see me do a quick tip, it will be quick. It will range between 5 and 10 minutes. So we had to change the name on that, but thank you so much for joining me for all those quick tips. They are up on our YouTube channel. You can actually go back on Facebook, you can go to the other social media networks, and also our website to see all those. So today is the first episode of A Different Perspective. It's one thing that I've always worked very hard on is to share the ability to look at things differently and get people to think. All right. Today is no exception. Today is actually by far the most emotional topic there is. I can tell you honestly, the fact that dealing with infertility, the majority of my career, a very emotional topic. Just from a, you tell a woman they can't have a baby, that is just one of the most emotional things that they can go through. The most devastating thing to actually hear from a family member or actually get the diagnosis itself is cancer. All right, so we're going to go into the details of it today. Now, I won't be able to cover every aspect of cancer, but the idea is this, is I'm going to give you a different perspective. Because if we look at cancer rates, they're skyrocketing all over the world. So let me set the stage because obviously you guys know I like politics and this has nothing to do with politics, but you've heard me say this many a times. You saw that we just had some recent Democratic debates. And actually the funny part was everybody said the same thing, universal health care, except for one candidate, which actually she said some amazing things. But here's what happens, is if you look at universal health care, they look and compare all over the world who has universal health care. But you know what they don't compare? The cancer rates. Because you know why? No matter who pays for it, cancer rates still go up. So if the perspective of cancer and how they look at it and what they do with it is actually continuing to go up, it doesn't matter who pays for it. The rate of cancer still goes up. And where people try to focus on is different survival rates. Well, forget dealing with survival rates. Most of you guys don't want cancer. Most of you guys, and the sad part is, 1 out of 3 statistically are going to get it right now. 1 out of 3. We need to change and have a different perspective. So I'm going to bring out some emotion into you today. I'm going to bring out some things that how I changed my perspective. Because let me tell you this over and over again. Even though that I have an extensive education, and it still was taught from a medical standpoint. And I don't know why. I honestly don't. I'm just going to say by the grace of God, I've always been like that rebel. Okay, that person was just like, no, if someone told me it's black, I had to, even if I didn't know, I just said it was white, okay? If everybody said this is the way you do it, I just want to do it a different way, okay? That nature in me, as I got older, started to actually question everything. And that's what I want you to do today. Everything that I tell you today, guess what? Question. I'm going to use all my references, which, once again, are just no different than every other textbook. This is actually UC Berkeley's medical school textbook, and I have Stanford's, all these textbooks from all the medical schools. I just recently updated all of them so that when people say, where do you get your information from? It's just basic immunology. It's just basic biochemistry. It's just that I'm going to give you a different perspective because if they continue to look at it the way they do, cancer rates will continue to go up no matter who pays for it. If it's universal health care or it's private insurance, if it's all free or if we got to pay for it totally, okay? Remember, just because someone else pays for a bad idea, guess what? It's still a bad idea. So now, what we're going to do today is we're going to really dig deep into cancer and the immune system, okay? Now, why? So what I want you guys to do is sit back, grab your coffee. You might need a pot as long as this one takes me to go through. Sit back. And let's walk through. So I want you to imagine this. And I hope this is not you today. I hope this is not you on the video today. Let's say that you recently got diagnosed with cancer. Now, before I go on, let me say this. I'm going to go into a very detailed but broad aspect of the immune system in cancer. And then in future perspectives, different episodes, I'm going to go into some specifics. I'll be very specific today, but I consider this stuff very general, okay? I'm going to go into all the major causal factors and things like that at different episodes. I'm going to give you a little ideas of them today, but I really have to get you to understand the immune system and how it really has to do with cancer, all right? Because you say, Doc, with your perspective and female hormones, and you've dealt with so much breast cancer and all the hormone components, well, let me tell you this. If the immune system was good, and quote me on this, if the immune system was good in the first place, I don't care what your hormone levels were, you're still not going to get cancer. Now, that's going to surprise a lot of you guys who say, Doc, there's hormones that can induce cancer. Well, that's not really true. It has to be abnormal amounts. But there's women that you know that have bad hormones their whole life, and they still don't get cancer. That's like this. They're like, well, Doc, toxins cause cancer. There's people that smoke every single day for 50 years, and their lungs are clear as a bell. There's people that eat like crap and overweight and never get cancer. Then there's a person actually that seemingly does everything right, and they end up with cancer at a young age. Or they come in contact with secondhand smoke, and guess what they get? Cancer. So how did this happen? Okay? And see, there's the perspective I want you to get. Is all these things, smoking causes cancer. Well, the people smoke all the time. Bad food causes cancer. Here, wipe that clean. I want you to do me a favor. I want you to just sit back, close your eyes, and wipe everything in your brain clean and see if I make sense to you. See, that's the whole thing about it this way, is I hope I can appeal from the simplistic part of making sense and then give you the action steps to prove scientifically everything I'm talking about. So let's do this. So let's say that you do have cancer right now, or let's say you've recently been diagnosed, or even you want to prevent it. This is how you start, okay? So let's look at the medical domination thinking today. You see it all the time. You see constant cancer foundations. You see pink ribbons. You see green ribbons. You see all these things this way. And people will go to major websites, which I'm cool with, okay? You just have to read through the lines. Because what they do, you're going to find out most people mislead you and they use emotions to do it, okay? I'm not going to do that. I want you to clear those emotions and just listen to my words, and I'm going to take you through just this immune journey of what we're going to do to do it. So understand, I need to set the stage a little bit, okay? Because if you had cancer right now, okay, one thing that you're going to do is you're going to start the research, which I'm cool with, all right? Because even when your doctor sits down and goes over their perspective, and I'm going to show you what their perspective is, and you're going to find out when I go through it, you're going, that kind of doesn't make much sense, all right? So let's start here. So let's say you found out that you had cancer. You're going to start to research. Well, let's pull up some of the most popular and the kind of thought leaders, which, for example, what that just means is they have the loudest voice. And remember, just because you have the loudest voice doesn't mean you're right, all right? So let's look at the National Cancer Institute. Actually, it's kind of interesting. It pops up very quickly if you type in cancer or what is cancer. And here's what happens. So I'm going to pull through this. I just want you to go through this and look at what they're telling you, okay? There's some things I agree with, and I'm going to show you what I agree with, and show you things that I do not agree with, and I'll show you why, okay? But let's just define what is cancer, all right? So this is on their front page. Cancer is the name given to a collection of relative diseases. I agree with that, okay? Now, basically, it's like this. Cancer, for example, actually has many forms. Why? Because it's differentiated in different tissues. If you have cancer of the liver, different tissue than cancer in the GI, okay? Now, in all types of cancers, some of the body's cells begin to divide without stopping and spread into surrounding tissues. Very general, but still kind of true, okay? Cancer can start almost anywhere in the human body, which is made up of trillions of cells. Yeah, roughly, I see people argue over this. I've seen people say 30 trillion to 80 trillion. My estimate, just as far as looking at everything that way, it's somewhere around 35 trillion cells that we have in our body. And on the average that they estimate, about 100 billion cells die and replicate per day. 100 billion, okay? So your chance of cell replication and being bad and good is actually quite high, okay? Now, normally human cells grow and divide to form new cells, totally agree, as the body needs them. When cells grow old and become damaged, they die and new cells take their place. Yes, it's called a cell cycle. Now, what happens? I want you to think about this. Cells grow, And what happens is they have a lifespan and then they die off. They actually have programmed cell death. Think about this. Our body is so genius, it actually has programmed cell death. It's called apoptosis. Okay? Once again, apoptosis. What it does, it just says it's a cell cycle, and you're produced to do its job. It lives for so long, and then it dies and splits and gets a new one. It's kind of cool. Okay? Think about this. That's why people don't realize. People say, Doc, I'm 50 years old. Can I heal? Yes. Your body is constantly building, regenerating new cells daily. Roughly 100 billion per day. That should blow your mind away. Now, I want you to think about this. If you're going to build a house that needs 100 billion pieces per day, you better be eating the right things. You better be bringing the raw material. We'll get to that in a little bit, okay? So, once again, I kind of agree with what they've said so far. Now, here we go. How cancer arises. Cancer is a genetic disease. Now you lost me. Now you totally lost me, okay? Your cells are not genetically programmed to go bad. Your body is genetically programmed to survive and actually do every function normally in your body. Think about your lungs right now. You've been listening to me for 5 minutes, all right? Your lungs have done exactly what you're genetically programmed to do, and that's normal function. But see, they right away, since they don't know what really goes on, because I'm going to show you, because they say right away how cancer arises. Cancer is a genetic disease. Yet you're going to find out in every website they say we don't know where cancer comes from. I love that. See, that's the point I want to go to. They start confusing people because the minute they tell you it's genetic, you think you have no control over it. Because they've taught you that your genes are actually static. Your genes aren't static. I don't know even where they get that thing. You know, they still tell you old things that people believe in that way. To listen to the aspect that the genes are actually a blueprint is actually misleading people very badly, okay? But let's go on. That is, it is caused by changes to the gene that control the way our cells function, especially how they grow and divide. Okay, now hold the phone. You got a little bit of truth there. That is, it is caused by changes to the genes. Whoa. Instead of saying changes to the genes, why don't we look at what stimulates the genes to replicate and do its job? See, so it's not really the genes, it's the environment that the genes have to actually respond to, okay? For example, let me give you a really example. So the Great Lakes is extremely poisoned. University of Wisconsin, Green Bay did a major study, so did actually DNR this way, and they found out that because of the toxicity, the environment of the lake, the amount of fish tumors, that's why they tell you don't eat out of the Fox River here. Don't eat the fish out of the bay. Why? Because of the amount of toxicity that actually the fish have to live in. And guess what happens? They start developing tumors and even change sexes. Let me say that again. They even change sexes. Should I say that again? They even change sexes. Do you understand? Now, that's quite interesting. These studies are well published. You can actually just search for them that way. Now, think about it this way. So the fish were developing tumors and stuff at a high rate, okay? The amount of bad cancerous fish is at an all-time high. So should we actually get mini hospitals for fishes and create therapies to actually get the fish to treat and then put it back in the water? Or should we change the environment that they're living in? See, that's where, for example, is you're not genetically programmed for cancer, but maybe the stimulus to our genes is actually really affecting it the most that way. Genetic changes that cause cancers can be inherited from our parents. This is where the big mislead happens. You know, maybe your mother had breast cancer and you had breast cancer because she didn't pass you down bad genes. She passed you down the bad habits that led to that gene to express what it's doing today. See, that's where our healthcare system has totally gone wrong. Nobody wants to take responsibility for the state of their body today. They want to blame it on other things. I'm going to show you how they do it, okay? So they go through and they talk about, now watch this. They can also rise from a person's lifetime as a result of errors that occur during cell divides. I love how they think the body is so stupid. The body is meant to survive for a long period of time. Do you understand that we understand very little about the human body? We really do. That's why there's new discoveries all the time that way. That's why half of the Gray's Anatomy textbook is what? Theory. That's why even some of the immune stuff that you see in here in all the textbooks is actually theory, okay? Now, what am I trying to do? I'm trying to put doubt in your mind from the experts that you've been listening to, because why? 1 out of 3 people are going to get cancer. It's not my stat. 1 out of 3 people all over the world, okay? All over the world. Doesn't matter what skin, who pays for it, all right? Now, I love this. or because damaged DNA caused by environmental exposures. Cancer-causing environmental exposures include substances such as chemicals in tobacco smoke, radiation, ultraviolet rays. Okay, I love how they actually just talk about smoke, environmental, then go to smoking, okay? What about all the other toxins, environmental toxins, for example, that go into people's body? Mercury, aluminum, a bunch of other things that can go from there. Plastics, okay? There are so many environmental factors. Now I'm actually going to do a whole different perspective just on that alone. All right, so then once again, each person's cancers has a unique combination of genetic changes. Also, cancer continues to grow. Additional changes will occur, okay? Now, once again, so we went on the same website and the same page, and they went from, it's the cells that just kind of outgrow, and it's genetic. Well, then why is it that every tissue of the body, for example, doesn't get cancer? Why exactly that the genes inside of our intestinal tract are the same inside of our liver? Why didn't every cell of the body get cancer? See, you need to ask these questions. Because if you don't ask the question and say, yeah, it's genetic. Well, doc, what do you mean? Do you understand? What do you mean? Okay? Because the idea behind it makes no clinical sense if you actually understand genes at all. Okay? Now, so here's what happens. Types of cancer. There are more than 100 types of cancer. It's based because, once again, the different tissues it affects. Types of cancers are usually named for the organs or tissues where the cancers form, okay? That's interesting to know, okay? For example, lung cancer starts with cells in lungs. Brain cancer starts in the brain. Cancers also may be described by the type of cells that form from them. Epithelial or squamous, okay? It's how fast they actually divide. Okay, and then here's what happens. They talk about you actually can go through cancers A to Z, okay? It's kind of funny because now the rate of childhood cancer is at an all-time high. It's interesting because you go back when I was a kid, you had very few children get cancer. Now, once again, the rate is extremely high. Okay, so did our genes change that much so quickly? See, that's why I kind of giggle. Even if you look at last week when I actually did autoimmunity and the immune system that way, even people that, for example, that understand go, genes can't change that fast. They really can't. We're not microbes. Microtic genes can change at a very quick rate. We cannot, all right? So once again, very common website, National Cancer Institute. So let's go to another one. A very, very popular one today. One of the biggest opinion leaders, for example, and the reason why I say opinion leaders, because they're one of the most researched. It doesn't mean they're right, okay? The American Cancer Society. What is cancer? Cancer can start any place in the body. We already know that. It starts when cells grow out of control and crowd out normal cells. This makes it hard for the body to work the way it should. All right, a little bit of generality there, but once again, cancer can be treated very well for many people. Here we will explain what cancer is and how it can be treated. All right, I want you to stay that way. See, they never say prevented. They never understand where it came from. They give the generalities of environmental exposure, infections, radiation, things like that. But I want you to think about this, because even on this website, especially when he talks about breast cancer, their idea of prevention is early detection. See, think about it this way. If somebody repeats something over and over and over again and enough people repeat it, people believe it. I mean, think about this. They have convinced women, especially when it comes to breast cancer, that early detection is prevention. That is absolutely ludicrous and so damaging to women and their health, it's ridiculous. Because by the time that they found it, it's a bad day. Imagine the emotion. You have breast cancer. And you've been under care for doctors for your breast for 20, 30 years. You're saying? So when you look at this, it's like going, this is their idea of cancer. Now, let's stay on the same website. How are cancers different? Some cancers grow and spread fast. Others grow slow. They also represent the treatment in different ways. Some types of cancer are best treated by surgery. Others respond better to drugs as chemotherapy. Often 2 or more treatments are used to get the best results. Okay? Now, once again, they went from there's 100 different types of cancers, that's basically 1 or 2 treatments. Now think about that, okay? Once again, now the major aspect, now you guys know this, you're already conditioned to think this way. If you close your eyes and think that, and you just say somebody has cancer, you automatically know that they're going to choose 2 therapies, radiation or chemotherapy, and then possibly surgery. It's programmed into you guys. It's programmed that the minute that somebody gets cancer, they actually ask people, what are your treatment's going to be? Now think about that, because that's how they program you to think about this. It's why the rate of cancer will continue to go up. Now, it's interesting. it's interesting because in all the immunology textbook, in all the cancer textbook, in all of the cancer websites, it's funny because radiation causes cancer, that they say. Yet the two most common treatments for cancer itself is what? Chemotherapy and radiation. Doesn't that kind of, you know what I'm saying? It's like, now remember, I'm sitting like, I don't know anything about cancer and sitting with you guys, but we don't look at it this way, okay? When someone has cancer, the doctor will want to find out what kind of cancer it is. People with cancer need treatment that works for their type of cancer, all right? Now, I love this one on the same website, all right? Let me take a little sip here. Now, guys, hang in there with me because I'm setting you up. I'm setting up the cards for you guys to understand this in a very different way. But I want to show you why there's so much confusion, because if they can keep you confused, you will follow through like sheeple. You'll follow through what they want to do based on fear, not based on education and science, okay? Now, why did this happen to me? People with cancer often ask, what did I do wrong? Or why me? Now, after they've told you all these things, here's their exact words, I highlighted red. Doctors don't know for sure what causes cancer. I love how right away, here's cancer, it's genetic, okay? And this. But then in the very next page, it actually, if you scroll down just a little bit more, it says doctors really don't know what causes cancers. When doctors can't give a cause, people may come up with their own ideas about why it happens, okay? Now, it's really funny. Some people think they're being punished for something they did or didn't do in the past. Most people wonder if they did something to cause their cancer. If you're having these feelings, you're not alone. Thoughts and beliefs like these are common for people with cancer. You need to know that cancer is not a punishment for your past actions. Yes, it is. Yes, it is. Yes, it is, totally. Do you understand? See, this is where they go, we don't know the causes, but it's not your own fault. If you understand cancer, then you'll be able to prevent it. It's really interesting because that's the part that we're missing. And then they say, well, it's not your fault. Well, what if I told you it was? I didn't make many friends when I just said that. I'm not here to make friends. I'm here to actually give you a different perspective. Because the perspective that's going right now, 1 out of 3 of you guys actually either have cancer right now or are going to get it. See, but I love how we don't know, but it's not your fault. But what if it is your fault? Let me ask you a question. What if it is your fault? Because watch, I'm going to show you how the immune system works with this, okay? Now, because people say, well, doc, but wait, I didn't know. I understand that. That's why I put this stuff out there so you can know. And actually, you can cross-reference everything I say. I mean this sincerely. Fact-check everything I do say. Because when you do fact-check it, you're going to find out that I'm teaching you just the basics of how the body works and why the success that we have with these things is so prevalent to know out there today. Okay? Because we're in a bad path, guys. Because you think, for example, watch the political debates. They're going to talk about the rise of healthcare. What about instead of worrying about the rise of healthcare, why don't you actually make less sick people? See, it's a different way of thinking. Now, so as we go through, it actually gets more confusing for people because they're like, okay, doctors don't really know sure what causes cancer. And then what causes cancer? This is no joke. You scroll down just a little bit more. What causes cancer? Cancer is a complex group of diseases with many possible causes. In this section, you can learn more about the known and possible causes of cancer, as well as the general information about carcinogenics and how genetics play a role in cancer. How are they going to be more confusing? I wish you'd just say, I have no idea what caused your cancer. We're going to put you through 2 or 3 therapies, and we're going to hope for the best. That's modern day cancer treatment today, guys. Correct me if I'm wrong. You can't. Because tell me somebody that you know right now going through chemotherapy and radiation or surgery based on their stuff. That's what they're doing. It's the standard of care. And we think standard is normal. It's actually very abnormal, okay? So once again, so you said, doc, you're making me confused. I hope you're confused. I really do hope you're confused. Because being confused, you guys should walk through this stuff with your doctors. And the sad part is what they'll do is they use emotional things to get you to do what they want to do. Okay, let me show you this. So let's pull a very popular, they do a lot of advertising on TZ. The cancer, oh, wait, here we go. Let me go here first, okay? How is cancer treated? We talk about standards, okay? The most common treatments for cancer, surgery, chemotherapy, and radiation. Did they talk about radiation actually causing cancers? You hear it all the time. Sun radiation. Oh, guess what? Radiation they use for therapy is much more damaging than the sun. See, and that's when they'll say these catchphrases. The benefit outweighs the risk. Well, once again, a catchphrase, an emotional catchphrase. So then therefore, when you look at the common therapies, surgery can be used to take out the cancer, chemotherapy to destroy the cancer, different forms what we do. Chemo is used drugs to kill cancer cells and slow the growth down. Hold the phone. To kill cancer cells and slow the growth down. Radiation is to kill and slow down. Surgery is to remove. So kill and slow down, kill and slow down, kill and slow down, okay? So then, once again, if you look at the Cancer Treatment Centers of America here, what is cancer? Once again, they go through the same standard of care. Everybody looks at the standard of care in the form of advancing chemotherapy, radiation, surgery. Okay? That is the basis for all cancer treatments. And it's a big business. It is. Because you're treating the effects of the cells growing. See, it's like this. It's like all of a sudden, let's talk about the toxic water in the Lake Michigan here. Okay? And it's no secret that the paper mills have poisoned our lakes like crazy. Big business has done a very bad job for toilet paper and all things like this around here to actually do what? And poison our lakes. So let's say that we actually want to clean up Lake Michigan. And we put a nonprofit foundation, raise funds, created equipment that could suck the toxins out of Lake Michigan. It's not really that noble of an idea. Do you know why? Because if the things are still toxic down the Fox River, dumping into Lake Michigan, makes no sense. See, cancer treatments are the same kind of format that way. You can actually even have reduced cancer cells, cancer is gone, stuff like that. But guess what happens in the majority of people? In the majority of people within 5 years, their cancers come back even more vicious. Because why? Because statistically, you're a cancer survivor if you make it roughly over 3 years. I want you to think about that. And actually, for some statistics, to what they do is they say cancer survival actually only has to be within 6 months. That's how they base their numbers, okay? They never ask you why you got cancer in the first place, how you did, because once again, they'll always come back to this. There's so many things that cause it. Well, once again, I'm going to tell you right now that you can actually pinpoint some very specific things to determine if you're even going to get cancer, all right? Now, so looked at their standard care, no matter where you go, no matter what you do for it that way, all right? So then what is their basis of cancer? Once again, it's the common theme all through this. Cancer is an uncontrolled growth of abnormal cells. Uncontrolled. Well, what controls it? See, what controls it? If there's such a major growth of cells, why is it that every organ in the body didn't get cancer? Why did some organs like the intestines, compared to like a brain, compared to like your liver, compared to like, intestinal or anything cancer, why didn't the whole body, and once again, get it that way? See, that's where I want to keep on going on this. If you look at some of the things, and there's some organs that barely ever get cancer. You never heard of heart cancer. See, why? Why is there uncontrolled? See, if you don't sit back and think about this, you get caught up in the emotion of, I'm going to die. And then instead of actually walking through and have people explain to you on a regular basis what's going on, you're actually making an emotional decision, and this is standard, and we're the experts. Well, the experts have led us to 1 in 3 people getting cancer. See, I'm going to just do a show on this, on the aspect of how, once again, experts, for example, change all the time. Do you understand? Experts said that DDT was good for us. Experts said that DES was good for us. Experts said all these things. And these are medical professionals. Experts at one time said smoking's not bad. Now they say it causes cancer. Okay? See, so that's the point about it all the time, that they change their opinions on a regular basis based on treatments that are out there. Now, cancer develops when the body's normal control mechanism stops working. I love how they just think the body stops working. Okay? Maybe it hasn't stopped working. Maybe you don't give it what it needs to work. Let me say it again. Maybe it doesn't stop working. Maybe you actually don't give it what it needs to work. And I'm going to show you how that works. For example, I have a 2018 vehicle out in the parking lot. All right? So I love my Denali's. I love the way they drive. I just like the vehicle. I don't care how well I take care of the inside, how often I change the oil. If I don't give it fuel and it's on empty, and I turn the car key, it's not doing anything. Now, I didn't say, the control mechanism stopped working. No, I didn't give it for it to work, okay? Old cells do not die and instead grow out of control. Well, actually, that's not true. old cells didn't do what they were supposed to because maybe they're deficient in certain enzymes and they can't die. You're gonna find this out. Some cells don't die because they don't have the right things to die. Oh, this is so cool. If you actually get this, it's actually kind of awesome. I can show you, and I actually have a person in the house today that had a brain tumor, found out when she was 8 years old. And we're gonna go over that in just a little bit. And I'm gonna show you, for example, that where her tumor was, they couldn't get at it. So the only way that thing was going to shrink is if we caused it to do what it was supposed to do, die, okay? Now, so you go through all these things, and once again, what do we come back to? Cancer treatment centers of America, surgery, chemotherapy, radiation, gets kind of repetitive, doesn't it? How is it that we have, once again, 100 different forms of cancer, yet the same 3 things come about? See, that's the point. So I was sitting there going, so something popped out to me on this. Okay, treatment options depend on the type of cancers and stage, if the cancer has spread or if it's in general health. The goal of treatment is to kill as many cancerous cells while reducing damage to normal cells nearby. Because that's one thing. These forms of therapy cannot be done without detriment to the whole system. Let me say it again. Those therapies cannot be done without detriment to the whole system. But something really caught my attention. And this caught my attention as a young practitioner, so I want to go back to this. I want to go back to everything when I was a young practitioner because that's how I started to work through these things, and that's why I want to teach you guys how I started to work through these things. Number 1, something really stuck out to me. The goal of treatment is to kill as many cancerous cells. And I had a light bulb moment. I was like, hold the phone. The job of all of the therapies is to kill or to make them die, which is another way of doing it, all these cells that actually have abnormally grown, doesn't work, all things like this. And the idea is this, I'm going, wait, here we go. There's something I start to question. I'm like going, wait, what was meant to kill those cells? Because our body, from the day we're born to the day we die, actually 100 billion per day, okay? Even as you're younger, it's probably higher than 100 billion because you got growth that way, but roughly 35 to 50 trillion cells, 100 billion are coming out. Our body's not gonna be like, okay, yes, we talked about it this way. There's programmed cell death, apoptosis, but then it's gotta be cleared out. But then what was meant to kill those cells? And that hit me. The immune system. Why I've been so obsessed with this since I was a little kid was the immune system, all right? Now, there's certain immune cells that actually will recognize the cells that don't belong there. So you've seen me put this up. I'm not going to explain this in detail. I'm just going to explain the end part this way. So I started to go, all forms of cancer treatment are just doing what the immune system was supposed to do in the first place. Think about this. The job of chemotherapy, radiation, and surgery was meant to get rid of and destroy the cells that were abnormally growing, that couldn't contribute to the host. Well, guess what? That's by definition, that's the immune system. So they're just mimicking what the immune system was supposed to do in the first place. So I started to work back and say, well, there has to be some immune problem then. And so I started to look at the cells that actually do the job of the 3 current therapies today. Let me say it again. I started to say, what cells are the ones that do the job of the current 3 forms of therapy that have been done for a long period of time, of surgery, chemotherapy, and radiation, and our whole system today is focused on making that better, which I have no problem with. Let me say it again. I have no problem with them coming up with better techniques of surgery, chemotherapy, and radiation. But what if, for example, we already have that master system inside you and it's not doing what it's supposed to be doing? Let me show you. So, point number 3, cytotoxic T cells. Once again, if you want to go back to our past teachings on immune system, they're in other quick tips. Go on our YouTube channel. Guys, if you're not on our YouTube channel, you're missing so much stuff. Please do me a favor right now. It's just Dr. Patrick Flynn or The Wellness Way. Go to the YouTube channel, and we're going to go through this in great detail. I have this stuff all on there. But to give you an idea, once again, any enemy can come in, or even a cancer cell, and our immune system goes through all these changes. I like analogies, so I put them together like the police department and how it all works that way. But those killers down here are the cytotoxic T cells. They're called CD8 cells. Now, you can actually do this. You can literally actually just type in CD8 cytotoxic T cells, and you can read all about them. They go and they kill everything that doesn't belong there, okay? So what we're gonna do is this, I'm gonna walk you through some basic things about them. Now, as you guys know, I'm a big fan of Mayo Clinic. Now you say, whoa, doc, wait, they do a lot of medical treatments. Well, they're one of the best diagnostic places in the world, if not the best. And so University of Rochester Medical School, which hooked up with Mayo Clinic, CD4-CD8 ratio, to me, it's the greatest immune test there is on the planet. Let me say it again. It's the greatest immune test on the planet because if your immune system, for example, is not doing what it's supposed to do, you're gonna get cancer. You're gonna get cancer. Because there's people that have bad estrogens and all the BRCA genes and everything like that, and guess what? They never get cancer. Do you know what I'm saying? See, so, and they're on. I've dealt with hormone-induced cancers, but guess what happens? If their immune system was doing well, they wouldn't have had a problem, okay? So let's go through this. You know, what does this test do? This test looks at the ratio of two important types of white blood cells. Lymphocytes are a type of white blood cells in the immune system. This test looks at the CD4 and CD8, okay? CD4 cells fight against infections. CD8 cells kill cancer cells and other invaders. Let me say that again. So your CD8 cytotoxic cells. So as a young practitioner, I'm going, what happens if I measure these on cancer people? But let's see what they really do. Okay, so what we're going to do is we're going to go to my other studio here, and I'm going to go through some of these things so you guys can understand in every textbook. Like I said, doc, where do you get your references from? Basically, every textbook, medical textbook on the planet. I was taught current chiropractic students, current naturopath students, current medical students, current cancer students, all things. We all learn from the same book. But if you come from the wrong perspective, if you think the body made a mistake, if you think things were abnormal or things weren't working, you'll never get this. It's how you approach it. I've used that example of where you see the picture of an old woman and a young woman on one picture, and I say, what do you see? Most people can't see both of them. If you can see both of them, you're going to be able to see things different than everybody in the world. So now, I'm gonna come over here. Okay, Brandon, are we over here? Yes, sir. Gotta make sure I'm under my right position here. Okay. So what I want to do is this, I'm just going to kind of go through a little bit. This all looks kind of Chinese right now, but I'm going to teach you how to read Chinese, okay? So if we look here, here's just the basic cell, all right? Now granted, there's a bunch of organelles in here. I didn't draw them in, but I did draw the nucleus. Can anybody tell me, actually get this. The first person that answers this, I'm going to give a free book. Every cell in the body has nucleus except for one. Does anybody know what cell doesn't have a nucleus? Let me see if, Brandon, anybody could put some comments down below. There is one cell in the body that doesn't have a nucleus. And the reason why, and I'll give you a little hint, is because it has to have a lot of room for hemoglobin. You guys better get that now. Let's see who the first person that puts that down is. That way you will get a free book this morning. We'll ship it out to you. Our media team will send it to you that way. But the idea is this, okay? There's one cell that doesn't have a nucleus. And actually, it's the red blood cell. Red blood cell doesn't have a nucleus, okay? But here's what happens. And it's the reason why red blood cells don't get infected a lot, but that's a whole nother story, okay? But here's a cell. Cells have a bunch of receptors. Inside the nucleus, there's a bunch of DNA, all right? So there's a bunch of genes in there. Now, what happens is very simple. See, for example, does anybody know what an infection is really trying to do? An infection is trying to get into a cell, use your DNA and RNA, and replicate. That's how they become who they are. They need that to replicate. That's what an infection is. An infection gets into the cell. Well, if all of a sudden an infected cell actually happens, let's say a little virus gets into a cell, he's going to go in there, and guess what happens? The cell starts releasing certain proteins. So wait, the genes start releasing proteins based on the environment in the cell, or even the environment in the humoral system that way, okay? And so the idea is this, so the environment cell lives in. So all of a sudden it starts releasing proteins, and it says, hey, guess what? I'm changing here. There's an infection here. I'm going to use a receptor, and I'm going to put a little marker out here. And that little marker is called the major histocompatibility complex. Who cares? But there's 1 and 2. This is for number 1. And all of a sudden, so what does it do? The cell is going through changes because it's infected. And it puts up a little red flag and says, hey, guess what? I'm different now from all the other cells. And so it puts up a little flag on the little receptor and says, I don't belong here. I don't belong here. Now, guess what happens? But it's still alive. It is, okay? Now, what a cell can do, even before this, before it's infected and things like this, so let's go through that cell cycle. So if all of a sudden a group of cells, they're actually growing, okay? Well, what happens is this. There's going to be more cells that grow, but some of these will die, and that's called apoptosis, programmed cell death. Now, here's what happens. In order to actually go through a cell cycle and just die from normal aging, what will happen is this. We need certain enzymes. Yes, you need enzymes to die. Let me say it again. You need certain constituents, enzymes to die. If you lack them, apoptosis can't happen. So if you're deficient in certain nutrients, your body's cell cycle, it can't die. That's why, for example, if you're deficient in certain things, okay, your body will not be able to program its own cell death, and then it'll continue to die or continue to grow. And that's how certain cancers can develop that way. That's why if you notice, you say, Doc, well, where do you get those constituents? Food. I'm going to show you there's different enzymes like they're called caspases. And if you're deficient in them, which come great from food, and actually guess what happens? There's food and herbs that actually give you the constituents, the enzymatic processes for your body to go through normal programmed cell death. So there's deficiencies. So if you don't even have toxicity, radiation, any of that, that's why people can do everything right and still end up with cancer. Because they're still deficient in things, even though overall things are pretty good. It's like having a brand new car outside and the car doesn't start. Why? No fuel. So this is a normal thing. Now, if that happens and all of a sudden the cell gets infected and it's released, it can't program its cell death, well then it has to depend on its immune system. Okay? Because all of a sudden there's a little flag there and the body says, hey, guess what? I don't belong here. And here comes those CD8 cytotoxic cells. And guess what? Its receptors grab on to here, and it will even release certain enzymes. It will even engulf it, and it will create an effector cell, and it will kill it. And it'll kill it. And that's just even basic infection. Well, you know what something is this? Guess what happens? An infected cell, chemicals, radiation, can change the actually cell on the inside, and now all these proteins are released. Now, when those proteins are released, once again, if there's no cytotoxic T cells to destroy it, it will keep growing. It can keep growing. It really can. It can keep growing because if it's deficient here and if it's deficient here, it's a bad day. It's a really bad day because guess what? These guys actually come and kill off all the infected cells, the cancer cells. Do you know there isn't really much difference on the inside from an infected cell and a cancer cell? Why do you think why do you think they've scared you about a lot of infections? Why do you think HPV infection is talked about so much? The reason why it's talked about so much today compared to 50 years ago, because everybody's sleeping with everybody now. So you can pass that virus to somebody, and if you're deficient and you don't have T cells, you better be worried about HPV. Now, what do they create? They create an HPV vaccine, which makes no sense. Which makes absolutely no sense because they're giving you chemicals and infection, and if your immune system is deficient and you're deficient, they're convincing all these young kids, young boys to get these things, and they've never even tested where their immune system is. And the way that we raise our kids today, we're so deficient in things, no wonder we have so much cancer in young kids today. And then they're giving these things that cause cancer. Isn't it funny? Environmental toxins can be injected into you. They don't talk about that. Immunology books, they won't even talk about it that way. They'll say environmental factors, and then when you call them and ask about environmental factors, they talk about, the in the water and the lead in the air and fuels and gas and all stuff like this. I said, what about the stuff they're injected into? They're injected into viruses and chemicals on a regular basis. You know what I'm saying? So the idea is this. So when you look at this, these cells, they release things, and then the immune system comes and says, we got to get you out. So if these are deficient, once again, if these are deficient, you're going to get cancer and you're going to get it badly. Because here's what happens. And then because you don't have your own therapeutic system to destroy all those cells, what happens? Your body says, they're going to grow. They're going to continue to grow. The cell, honestly, once again, since it can't program itself for death because it's infected, what it does, it's dependent on the immune system. And see, this is the part you got to worry about. And you know what's really funny? Do you know the easiest way to build up cytotoxic T cells? Exposure to infectious agents when you're young. Let me say it again. Exposure to infectious agents when you're young. So when your kid goes to a daycare at a month old and comes with a cold, that's produced. When your child gets chickenpox, that's produced. when your child goes through all these great childhood infections, that's produced. No joke, look it up. That's basic immunology. So without your child going through childhood infections and letting fevers go up and letting it go through that immune cycle to build these, because these are built, let me say it again, they're built and create memory, and then they're with you the rest of your life, it actually makes you better to clean out all the cells that do not belong there in the first place. Think about that. We do it so backwards. We're so scared of infections when our children are little, and we don't realize this. The thing that they have programmed you to be scared of is actually the biggest thing that's going to prevent you to get cancer in the first place. Because it sets the immune system up to go, you don't belong here, Mr. Infection. And there's not much difference between an infected cell and a cancer cell, and you build these buggers. Oh, see, that's what's just going to be so excited about watching my little girls grow up. I just get so excited when school comes around in September, because they're going to go to a big old petri dish called school. And they're going to get all these different viruses and bacteria, and they're going to, and they're going to puke. And Daddy's going to be so darn happy for them, because I know their cancer prevention. And then we give them the things needed. I'm going to show you some really cool stuff that you can do. I'm going to show you the girl that's in studio today that I gave to actually help her brain actually create apoptosis and kill those tumor cells. And that's what it does. And it's well documented. Now, this is basic immunology, guys. Every textbook, just Google search this, no joke. Actually, don't use Google, they're censoring you. Use DuckDuckGo or whatever it is that way. They're actually, because actually it's kind of funny, Google's starting to censor people for actually giving out good information. That doesn't fall within the medical realm, because you know why? Because they're paid off too. Do you say? See, this is basic stuff. No one can stop you from learning. This is basic immunology. Now, here's one thing I want you to show you though is this. Let's say this whole thing is deficient. You don't have this, you don't have this. You know what increases the replication of these cells? It's called stimulation on receptors for mitogenic hormones. Mitogenic hormones, like estrogens, like certain estrogens. But one of the strongest mitogenic hormones there is hanging out right here, insulin. Insulin. Yes, insulin is more of a growth hormone. Yes, so many people know about sugar regulation, but it's a growth hormone. That's why insulin will come on this receptor right here and cause this to replicate faster. That's why sugar will induce the growth of cancer faster than anything. Do you understand that a cancer cell uses 10 times the amount of glucose, it's called gluconeogenesis, than actually a regular cell does? So one way to inhibit the growth is reduce your what? Your sugar intake. Basic biochemistry, basic immunology. Simple. It's actually not that hard. It really isn't. Brandon, let's have back there, studio. All right, you're back here? All right, so now, once again, a different perspective of how to look at the immune system and how it works and how actually the hormonal system can contribute to it that way. Now, what I want to show you, for example, is a real life person. So here's a 67-year-old person that came with cancer. Cancer. Guess what happened? Her CD8 cells are basically non-existent. See, you can measure these things. What's the Wellness Way motto? My motto was never give natural things. My motto was to test where all these biochemical, immunological, and physiological things were, and then assess the body, and then find out what it needed. What it needed. So this person, once again, had cancer. I will say had cancer. Now why? Because once again, as I figured out the immune deficiencies and started to figure out where they were coming from, and that's a whole nother show, and we'll do that. Things that actually take those cytotoxic T cells down, with the exception, because this person got infections when they were little. But even when you get infections, if you beat the crap out of your immune system and destroy it, once again, you can have low CD8 cells, but as we start to build them up, we retested them, and they start to increase dramatically. And the coolest thing about it is this. The person's cancer started to disintegrate. Why? Because we came up with some cool natural treatment? No, that's not what we do. That's not what we do. You don't think that way. Medicine has chemotherapy and radiation and surgery to try to kill and destroy and shrink and inhibit their growth. I'm saying, listen, if you do things proper with the immune system, and you can get that thing to actually go in the right direction, you'd be surprised what the immune system can do even to a big tumor, even to a big cancer. Now, so on that point, I'm going to bring this young lady up. Coming up here, Lydia. She's going to come stand right over here for me. Good morning there, darling.
Good morning.
So this is Lydia. Some of you guys have maybe seen her in past video. And once again, guys, I chose her today because it's an emotional story. And I'm gonna walk her through, she's been with me since she was 12, right?
12, 13.
12, 13. Yeah. October 31st. When's your birthday?
September 29th.
That's right. That's right. Right after there.
Shortly after.
Yeah, shortly after. It was kind of funny. And now she's 20 years old. You're going to be 21 this year.
Yes.
Yeah, so she found out she had a brain tumor at 8 years old, correct?
Yes.
So tell me what that was like as an 8-year-old finding out that you had a brain tumor, because you're 8. You're a young lady, okay? What was it like?
It was heartbreaking. It was heart-wrenching. I remember when I was first diagnosed being in the emergency room with my dad and just bawling our eyes out, thinking it was the end of the world.
Yep.
And it just wasn't good at all. Yeah, it was heartbreaking.
It was heartbreaking. Now imagine this. Imagine that this is your 8-year-old daughter. I know her parents quite well. I know her sister and her family quite well. And it's interesting because the thought process and the survival rate for them is low. It is, because she had an inoperable, because sometimes the therapy couldn't even work. They couldn't do chemotherapy on there. They couldn't do surgery because where it was. So they tried what therapy for a very short time? How long?
Radiation therapy for a week.
A week. And because of that, they had to stop, because their therapy itself was starting to be detrimental on her. So therefore, they told you
that it was inoperable, and I was a patient that was totally helpless.
Helpless.
Much.
Now imagine you're a mom and a dad. And then once again, I know this mom and dad who I absolutely adore, okay? Actually, it's kind of funny. And how we met Lydia, not a joke, is Timberland, as you guys know, Timberland does a lot of our food consults for offices all over the country. She was actually our nanny. And she goes, and she didn't really know what she did, and she was one of our first nannies, and all of a sudden she found out what to do. She goes, my sister has a tumor. And so then all of a sudden she started to come in, and it transformed her life, even to where your sister became a nutritionist, because it affected her life. Because then she came here and re-ran her labs on her, and lo and behold, you were seeing at Children's Hospital in Milwaukee, correct?
Yes.
And once again, Children's Hospital in Milwaukee is one of the premier places for medical care for kids. I think they're wonderful, okay? But even in their therapies today, they couldn't take care of her because of where it was at. So then we measured Lily's immune system. Now imagine this. At an 8-year-old, we had to tell you no sugar, nothing inflammatory, all these things together, and it was difficult, wasn't it?
Oh, so difficult.
Yes, but I got a cool story. Now she doesn't know. She doesn't know what I'm gonna say about one part today, because it's kind of fun, because I want you to follow her on Facebook. She's actually documented her journey through the process. So then we started some things with her. And once again, I'm not going to tell you what we did with her. Do you know why? Because all the people who had a brain tumor watch this, they want to do the same thing. That doesn't work this way. You can't treat anybody the same. This is not Lydia, but this is that 67-year-old person. But this person, and I'm going to show you a different lab, you have to go at it from different standpoints, because you have to build their immune system with different things, okay? So we started the aspect that way, and then I think it was, 6 months later, Children's Hospital did another.
Oh, no, I started October 31st, right around there with you. And that January,
yes, 3 months later.
Right after.
Yes, because she was in a detrimental state where the tumor was actually growing at a regular basis that way, and so it was helpless, to them. And so then I said, well, listen, here's where we're going to start. And I remember when your mom and dad asked me this, what do we do under your care? I don't care. See, that was my response. People say, Doc, should I do this or should I do this? I'm like, I don't care. Let me do what I do, okay? And so then we did it in 3 months. What happened to the tumor?
Shrunk
tremendously. To shrink. Yes. And then she started to have MRIs and stuff done every 6 months, and the tumor continued to shrink, okay? Why? What did I give her? It's not about what I give her, it's what I did to support her body to do what it's supposed to in the first place. It did what chemotherapy and radiation and surgery would have done, because we have our own mechanisms that do that, okay? Now, here's one thing that she doesn't know I'm gonna talk about today, because this is what I want everybody to understand. So, all of a sudden, things start to go in a really good direction. Even Children's Hospital is like, we don't know what to.
They didn't want to see me after my last MRI. They said, whatever you're doing, keep doing it. We don't want to see you. Yeah, come back whenever.
I'm like, no, they'll get this. I'm actually telling their parents today. I said, I don't like that. Now you're saying, what, Doc? You want her to go back to Children's Hospital? Yes. I want them to monitor the tumor. I want to make sure it's always staying in the right direction that way. And they say, well, you don't have to really come back. I'm like, whoa. No. Because see, what they did is they're going, well, there's nothing we can do, so we'll wait until it comes back. I'm like, it doesn't work that way. Nope. They're thinking that way, just totally, and it happens all the time. So then guess what? Now here's the part that where Lydia, why I want you to actually follow her on Facebook. And what's your Facebook page?
Lyd.
L-Y-D, right?
Yep, L-Y-D. And on Instagram, Lydia Marie.
Okay, because here's what happens. Because as that started to go good, you have a young teenage girl. And habits are so tough to follow, correct, Lydia?
Yes.
So, yes, see, because it's really funny, because I would be like, Lydia, if you don't keep your habits good, it's going to be a bad day for you. How many times did I tell you that?
So many times. And as a teenager, it hasn't had its ups and downs.
Yes.
And it still does.
That's the key. So the fear of not dying has went away. So guess what happens? She actually got sassy.
Yeah.
She got sassy. And I'm like,
yeah.
Lydia, stop this. And I'm like, that's my job as the doc, is to keep her on the right things so her body stays the way it's supposed to do. So it wasn't environmental factors that was causing your problem. It was her.
Yeah. There was a couple years time when I was starting to get better. I was a teenager, and like any other teenage girl, you want to be like everybody else.
Yes.
So I kind of like put a mask on and pretended to be somebody I wasn't. And it wasn't up until like a couple of months ago, like I woke up one day and I was sick of where I was at, and I was like, okay, this is not definitely who God created me to be. And I'm gonna be that person God created me to be.
Yes,
which is my story.
Which is a happy, healthy, vibrant young lady. And so she came back in and got her testing done again and stuff like that. She pooped in a jar for us. You know, the good stool test, because you can see your immune system, what's going on a little bit that way. And so it's kind of cool because, and she even came, she goes, Doc, just have me do all the testing. I said, no, Lily, we don't need to do that. There's specific things with your history that we can do to get you on the right track. And so then she's now documenting her journey, okay? Because here's what happens. That's the whole part. Because if she didn't make that change, I even pre-warned her, said, listen, if you don't keep the habits good, habits and the things that you do, it's going to come back. Now, the great thing is it's been doing extremely well, because our immune system can take a lot, but that we shouldn't do that, okay? Because she's more now susceptible to those things because of what happened before. So, once again, Lydia, thank you so much for coming on today. Thank you for sharing your story with her. Once again, she has done amazing things. She's an amazing young lady. Follow her to actually see her journey to continue. And the one thing I want her to share the most about this way is living a good lifestyle is a struggle today. It is.
Oh my gosh, today's society.
Especially for her age. And it's why our kids are so sick today. So thank you, Lydia, for everything. Thanks for coming on today. So everybody do me a favor, say hi to Lydia in the comments below in that way. And like I said, you can follow her and watch her journey. And we have thousands and thousands of people like this. I wanted to bring her on because that was a form of helplessness that they went through. Think about that was your child, and a child's 8 years old and said it has an inoperable, untreatable tumor. Do you know what I'm saying? Now, I will go through some of the things I did with her, okay? Not clinically, because here's what happens. All of a sudden, everybody grabbed their paper and saying, what did you give her? No. No, what I realized was the fact that when those neurological cells, because here's what happens. Each tissue is different. Let me say it again. Each tissue is different and needs certain constituents to create cell death, even cancer cells to die, apoptosis. So there's certain ingredients that each cell needs. And the GI needs something different than the brain. And the liver needs something different than the GI. And guess what? Every organ, okay, the kidneys need different things for apoptosis. But then on top of it, our immune cells need certain things so they can get to a normal level too. You need to feed your bone marrow what it needs to do it this way. You need to give the body what it needs to do what it needs to do. For example, here's a 50-year-old person, okay, another female. Once again, CD8 cells, pitifully low, pitifully low. This person is susceptible to infections. This person is susceptible to cancers. This person is susceptible to every immune disease on the planet that way. And I was like, oh my goodness. And I start to realize that I have not yet, in 20 years, I have not yet, with all the offices across the country, have a person have cancer and not have a bad immune system. It's actually almost synonymous. It's why, for example, therapies are based around what the immune system was supposed to do in the first place. All right? So once again, you want me to go through another one? Low. Because once again, as you see on the labs, I'm talking about CD8 cells, but I measure more than that. You need a comprehensive immune testing. And that's a big key. Because let me show you, I did it on a 1-year-old, okay? Because this 1-year-old didn't have cancer, but I want to show you something. This child actually had major problems. This child was actually from Alaska. Why do I put that up? This child at 1-year-old was very sick. At 1-year-old. Now think about this. kids today are an all-time high for illness. Their immune systems are massively abused when their mom is pregnant with them. They're not teaching moms what to eat and what to do. They're giving mom flu shots and other things during time that are extremely detrimental to the immune system and how the baby gets its immune system. They actually create a very sterile environment in a delivery room instead of actually having a beautiful bacterial-based clean room. They actually swab a woman's vagina to wipe out any normal bacteria. They're putting silver nitrate drops in the eyes, which is an antibiotic because they treat every woman like they have an STD. They wipe off the baby instead of leaving that beautiful white covering that the body produces to cover the body from bacteria and viruses when it comes out to the mother. They actually give it hepatitis B, which only prostitutes and IV drug users gets when they do it and abuse the immune system. And we wonder why our kids are so sick today, and they tell them have formula, not breast milk. And people come to me and go, I don't know why I'm sick and I'm 20 years old. I don't know why my children are sick. Well, guess what? This child was 1 year old and the immune cells were devastatingly bad. Let me ask you a question. I got it right up here. What's that child's future? Think that child's future is cancer? I'll bet my life on it. Now, thank God the child actually found doctors that understand this, aka the Wellness Way docs. And now this child will actually grow up coming from a different perspective. Because you know why? The mother had to call from Alaska. Because why? Because there was no doctors up there that thought this way. That's the sad part, guys. I'm going to continue to give you a different perspective on how the body works on a regular basis. And you can fact check everything I say because I'm just teaching you the basics. This is basics. This is the simplest things about how the body works and what you can do with it that way. Now, so what is the best thing we can do? So doc, so what do we do? Number one, get tested properly. That's it. That's the start. How can you assess T-cell and CD8s and all these things this way without proper assessment? But the only people, honestly, this is not a joke, if you were to type in CD4/CD8 ratio, which is one of the major tests for immune system that way, the only people that get that is HIV patients. Because why? Immune deficiency syndrome right there. That's why most HIV people die from a basic infection, because their immune system is so deficient, okay? It's very sad. It's why, for example, you need to get tested properly. But how do we get tested properly? There, I listed it for you. Write it down. Actually, we'll post this. We'll post this in the comments. CD4 natural killer cells, CBC, CMP, CEA, carcinoembryonic antigen. This test right here is one of the greatest immunological tests if you have cancer, by far, because it gives us the great state of the immune system and the rate of growth of cancer. See, it's one of the most important things that you can do to get to the basics of the immune system. It's funny. CEA, carcinoembryonic antigen. There's two people that have the elevated, cancer people and actually pregnant women. Why? Because pregnant women are producing a lot of cells at a really fast rate. They're supposed to. They're growing a baby. See, it's kind of funny. You got to see where the state of the body is that way. So this is a great way to start, okay? Number two, what can we do? Broccoli sprouts. Now, how did I go all the way from all the things this way to broccoli sprouts? Well, I have to thank that lady last week. As you guys know, if you didn't watch last week's quick tip, a woman actually emailed me, just to read a story if it's the first time you ever watched. She said, Doc, I live on a very limited budget, and she goes, at the end of the month, I have about $60 left over. I can't even afford a basic food test. Is there things that you can give me pointers on what to do? Every quick tip, aka now a different perspective, and I said, absolutely. So I start to give different things that people can do and to help them move in the right direction to keep their health really good. Because no wrong, I'm always going to tell you get assessed properly with testing first, because that's how you really figure out the body is. But some people can't even afford the basic test. They really can't because they live on a limited budget. So I'm going to always share some things. Broccoli sprouts. Why? Well, it's kind of funny. Do you really think that, for example, that people really care about you being healthy? I'm going to tell you, no, they don't. Including Johns Hopkins University that conglomerated with a political organization to try to patent the enzymes in broccoli sprouts. Actually, thank God, it all went all the way up to the Supreme Court, and they denied the patent because John Hopkins and another group that calls them the Cruciferous, the BRCA-based Research Foundation, which is another form of a cover-up nonprofit organization for the medical community, tried to patent broccoli sprouts because the enzymes that it has in it cause major apoptosis in what? In cancer cells. Well, so they were trying to patent them so they couldn't be used as a food. And thank God the Supreme Court got it right. Do you know what I'm saying? And they said, no, you can't patent that. And that's why you see a suppression of information like this. That's why Google and all Facebook and all these people suppress information. Durang, I've already been censored. Isn't it lo and behold that the minute I say the word vaccine, my videos on Facebook start to flicker, start to be shut down and stuff like that. Dr. Mercola, who I believe has brought great information to the world, I have huge respect for him, getting censored by Google, getting censored by medias that way. Because why? Because they're owned by pharma schools just like everybody else is, and we're not. See, and so they tried to patent what happened. They even had the full court case and everything. It's online, you can do it. Because why? They found out that broccoli sprouts, so not broccoli itself, the sprouts, actually have major enzymes that can affect almost every tissue in the body to give it what it needs to have the enzymes to create apoptosis in cells. That's the coolest thing. You can grow them in your own house, even if you live in the city, just by putting it on your ledge of your window. Dirt cheap, simple, easy. I love this stuff. What else can we do? Garlic. Oh, you betcha. Garlic is actually one of the greatest things for our cells that way, especially in cancer aspects, okay? Kale, the cruciferous aspect of it. Now, you want to kill two birds with one stone? Look at my kale chip recipe. It has Celtic salt and garlic on top of it. Man, you just tear it up like crazy with that kale chips. Go to the website. Do me a favor. Go to the Wellness Way website. Sign up for our newsletter. It comes out multiple times per week. We put out the best information that gives you great lifestyle things like this, okay? Broccoli sprouts, garlic, kale. Cut out sugar. I know. It's so tough. Lydia, I used to scream at her. Lydia, knock it off. Your tumor is going to come back. Okay? And she showed you before, it's very emotional. Food is the most emotional thing that we do, bar none. Bar none. Okay? So understand, cutting it out is important. Plus, when those cells do develop, cancer actually can live on sugar. It's why when you start to reduce your sugar intake, the growth of cancer does reduce. And it's really funny, because get this. Here at the oncology places, there's people that have soda machines and donuts in their waiting room for cancer people. That's how clueless they are. See, we always have like, well, they're good people. You know what I'm saying? Well, they're good people because they perform a job. It doesn't mean their intent is right and what they're doing is right, okay? Their intent is right, but their method of doing it, their actions don't line up for the way the basics of the body uses. So if any doctor tells you that cancer has nothing to do with sugar, I punch him right in the face. I tell people, we gotta stop being like, well, just disagree with him. No, because he's actually continuing hurting people. We have to stop people from hurting people, okay? Now, medicinal mushrooms. Oh, if you want to know how, see, that's where medicinal mushrooms actually have a different effect on every immune cell. The medicinal mushrooms have an effect on the thymus gland, on the bone marrow. Medicinal mushrooms supply the ingredients. And the coolest thing is when we test a person, we can use specific agents to help that CD4 and CD8 ratio and all those natural killer cells and cytotoxic killer cells go back to the normal state so it can do its job. What else? Resveratrol. Yes, resveratrol has been known as a fantastic producer of apoptosis of a lot of cancer cells. All right? That's why they tried to patent resveratrol also. Now, it's funny because a lot of you guys know this. Where does resveratrol come from? It comes a lot from grapes. That's why you see resveratrol in wine actually been known to help. Except for, hold the phone, there's a little caveat there. You got to be careful with the sugar levels in most wines today, okay? Because to ferment it, you sometimes need a lot of sugar, and then you have a lot of sugar in wine, so you got to be able to catch 22 that way. There's better ways to get resveratrol than wine, but wine does have certain properties that actually are apoptotic and stuff like that, so something there. Now, it's really funny because I can honestly tell you, chamomile. I'm going to give you a little bit of clinical insight on chamomile. People don't realize what chamomile actually does. People say, Doc, it calms the GI down. Yep, and guess what? It actually helps produce a very well mucous membrane throughout the the membrane aspects of our GI and our lungs and our brain. But guess what? Chamomile has other properties besides that. Chamomile has properties that actually expose the result to differentiate apoptosis in cancer cells in the GA, but actually doesn't cause apoptosis in normal cells in the GI. Pulled from your PubMed research. You'll never get that from your cancer doctor. So if a person has GI cancer, they found that by actually taking chamomile, what they found out was the ingredients in chamomile, which once again, that's our job to know what the ingredients are. Chamomile is not just a GI soother. It actually helps maintain the integrity of good cells, but then gives the constituents and enzymes for actually things in the GI from small intestine, large intestine, to cause breakdown and apoptosis of them, so those bad cells die off and you only have the good cells left over. It's why chamomile actually has such a great effect on our GI. It's so good for it because it keeps good cells good and causes the bad cells to program cell death. That's some cool stuff. See, the greatest thing about these things, there's things that you guys don't know about that are just basic. If you look at the constituents in chamomile, okay, or in any herb or in any nutrient, they actually are consumed by the cells and the genes do exactly what it's supposed to do. The genes respond to its internal environment, but what if you're deficient in that environment? What if you don't have the right ingredients? Or what if the ingredients in there cause actually the cell to actually transform and turn into a cell that's not working towards the whole, aka cancer cell? Then you're dependent on your immune system now to clear out all those things, but what if your immune system is deficient? What if not a doctor has taught you how to take care of you when you're pregnant, how to take care of your child when it's born, how to raise a healthy child, and then we wonder why there's so many cancers today? See, what we need to do is this. We need to stop listening and start learning. It's what a different perspective is all about. I'm going to continue to teach you the basics of biochemistry, physiology, and actually immunology every single week. I will put out little quick tips on a regular basis, because yes, they will be short, on how this stuff works. But my Saturday mornings are dedicated to you guys to actually get you to learn. And the coolest thing is this: don't listen to one word I say. Take it in and then start your own learning. Because you know why? Because you don't want to learn when you're the 1 out of 3 person being cancer, because you have to make decisions right now. You have to make decisions right now because you're scared, you're emotional, and once again, and you're always going to move towards what the norm is, and it's chemotherapy, radiation, and surgery. And what if I told you didn't have to do it? What if I told you there was a different way? What if I could show you this could be prevented at such a high level if you just understand the basics? See, no one will deny what I teach. They'll deny the conclusions emotionally. They'll say, people die of cancer. Yes, who was taking care of them? I want you to think about this, guys. If you're 40 years old and you just got cancer, who took care of you since you were little? A perspective that led you there in the first place. Do me a favor. We need to stop listening and we need to start learning. This is your body. We got one shot at this. We got one shot at this world. I'm gonna make it the best. I'm gonna do everything I can and give my body what it can do from an apoptotic standpoint, so it destroys bad cells. I'm gonna give my immune system everything it needs. I'm not gonna destroy it with things that can destroy it that way. And once again, because I learned this. And it's really funny. The majority of stuff I learned didn't come from my education. It didn't. You know what I'm saying? My education didn't teach me how to take care of my wife. My education would have led me down the same path every woman ended up like Christy would have been, infertile, sick, all these things. Because you know why? The perspective is just a natural perspective of medicine, the fire department. And I said, listen, that's not what we do. The carpenter standpoint is, once again, how to build the body and actually how to repair it. So once again, we need to stop listening and start learning. God bless all you guys. Thank you so much for watching today. Tune in next week. We will continue this topic as far as cancer and to show you some of the things that cause those cells and the environmental factors and all the things that can do that. So God bless all you guys. Hey, thank you for watching. Make sure to subscribe to this channel so you don't miss a single video or live stream. Also, share this video with a friend. Once again, thank you for watching.